this is like to continue our web series of the virtual health talk. Today we have Dr. Chandan Chaudhari sir, who's a consultant nephrology at Wockhardt Hospitals, and again along with him we have Dr. M Bahadur sir, who's a senior consultant nephrology at Wockhardt Group of Hospitals. So we will start our session with our health talk. So I would like to request Dr. Chandan Chaudhary sir to continue with our session, sir.
Yeah. So, good evening, everyone. Myself, Dr. Chandan Chaudhary. I'm a nephrologist at Wockhardt Hospital, and our senior nephrologist, Dr. M Bahadur sir, is also there. So, the today's topic was about early diagnosis of kidney disease. So, here we just want to give you in a very brief manner what are the telltale signs where we can know that this person need a further evaluation for the kidney disease, or what are the ways we can get to the cause of a kidney disease or a reason of a kidney disease. So the plan, the way we will be moving forward is I will be in short telling about the slides, what are the simple points, and after that the sir, Dr. Bahadur sir, will be taking the discussion and question answer session. So this was about the early diagnosis of kidney disease. Priyanka, next. Yeah. So the points or the important points under which we would like to discuss this will be history. The second important will be the family history. Then screening in diabetics or hypertensive. Of course, the fourth and very important point will be the blood pressure, urine routine, ultrasonography, and renal biopsy. These are the some points under which roof we can discuss about kidney disease symptoms or workup for a kidney disease. Next slide. Yeah. So whenever we are talking about the history, the patient who is telling us that I'm getting repeated pedal edema or swelling or feet, or especially if they are telling you that I'm getting a lot of frothing while passing urine, or they are telling whenever they get up in the morning and they are having periorbital puffiness. Previous slide was about history. So I would like to tell you one very important point, that not every patient should get some or other symptoms related to the kidney disease. Many times this happens that people may not have any early signs, symptoms, and still they may be having an advanced kidney disease. Okay, so but these are the common things, common symptoms which usually you can focus on, like swelling or the feet, periorbital puffiness or periorbital swelling. These are the things where you may start suspecting that this guy need workup. Okay, next. Yeah, here the frothing in the urine was also an important point. The frothing in the urine sometime you may start suspecting that whether he is losing protein in urine. Sometime, of course, which is not over here, that is the blood in the urine, or white urine which is having a pus in the urine, or pyuria. So these are the important points in the history that you may need to start suspecting towards the kidney problem, and you may start workup, basic investigations, blood investigations, or sonography to lead to cause of a kidney disease. Next. So family history. Now the family history, why it is important, especially if there is a family history of a kidney disease, especially in a first degree relatives like mother, father, brother, sister, then these are the patients who may be at high risk because for the kidney disease. The second important thing is in the family history with the common diseases of course the polycystic kidney disease. The polycystic kidney disease, you are most of the time you are going to get the positive family history that there was a history of a kidney disease in maternal side or paternal side. Sometimes yes, the family history of even a kidney stone, strong family history of kidney stones, you may find that everyone in the kidney stones and the repeated kidney stone is causing calculus pyelonephritis, scarring on the kidney, and slowly they may be losing the kidney function. So the family history, if you are having such family history, if you are having family history, there are many genetic diseases which may run in families, and it may make you prone for a kidney disease. So even at least some screening once a year, once in 6 months becomes important to diagnose it early. Next slide. Now coming to the next point, the screening in diabetics and hypertensive. Here, I just would like to emphasize on one point. Many times the people may say if it is genetic disease, the anyways the disease is going to come and what you are going to do. But please try to understand whenever we are talking about the kidney disease, it is not just that the pass or fail matters. It's not that the when the patient is requiring dialysis, the kidney failure is there, and when the patient is not on dialysis, that means kidney is doing well. No, the kidney may be getting weaker, further weaker, and then when the function is remaining just 15% of the expected kidney function, that is a time the dialysis is required. So if you are diagnosing at early stage, you may be able to prevent the further progression. You may be able to slow the further progression, because this kidney disease usually is staged into the stage 1, stage 2, stage 3, stage 4, and stage 5. So even if you diagnose at stage 1 or stage 2 or stage 3, and you start working on, you may be able to delay the stage 4 and stage 5, which helps you to reduce even the financial burden and associated morbidity on the patient's health. Because as the kidney disease progresses, definitely the cardiovascular risk increases, the other complications increase. So, of course, the financial burdens increase. So, in all the ways, it is going to help to slow down the further progression of kidney disease. Coming to the next point, screening in the diabetics and hypertensive. Why this is important? Because if we go to any country all over the world and we take kidney patients, we will see that the maximum number of patients, the reason for the kidney disease is diabetes or hypertension. So what I feel that especially the patients who are having diabetes or hypertension, what they can do, they can at least go like twice a year, every 6 months, or annual checkup for their kidney function test, like urea levels, creatinine levels. Sometimes they can just at least go for a very cheap blood test, which is a urine routine. And if it is showing the protein in the urine, that is a sign where we may need to work on the kidney front, or we may need further evaluation why you are losing the protein in the urine, whether there is any problem at the filtering membrane in the kidney. Then there is a condition called as test called as urine for microalbumin. So this test is especially important in a patients who are diabetics, because in diabetic patient, even if their renal function test, blood urea levels, creatinine levels are normal, their urine dipstick method is showing absent protein, but still they may be losing the protein in the urine, which is known as urine for microalbumin. And if there is a presence of microalbumin in urine, it is the early stage of diabetic nephropathy where you should start working on to slow down the further retardation of kidney function. And of course, the associated important thing which need the screening in a diabetics and hypertensive is end organ effects. What do you mean by end organ effect? If, for example, if you take a diabetic patient, the diabetic patient may get diabetic retinopathy, they may get diabetic neuropathy, they may get diabetic nephropathy. So these end organ effects, if they are there, then you may start suspecting that this guy may develop even a nephropathy or kidney involvement in the future. So we need to be more careful. Next slide. Now coming to the blood pressure point. Why this blood pressure point is again very important, that whenever you are seeing the blood pressure patient, or whenever we are seeing a diabetic patient, it is not just the controlling the level of sugar or controlling the level of the blood pressure is important. Sometimes it becomes very important that why this person has got blood pressure, how I can control the blood pressure, and the third important thing is how I can minimize the effect of blood pressure on the organs like brain, heart, and kidney. So whenever we are treating the blood pressure, these all 3 points has to be taken in the consideration rather than just treating the blood pressure level, whether it is under control or not. So whenever we are seeing the blood pressure about the person with having a blood pressure or hypertension, the very important points which we need to see is our age of onset. Because young onset hypertension means the hypertension which is happening especially in a people who are less than 40 years of age, 40 to 45 years of age. The most common reason is usually the renal parenchymal disease, means some problem related to the kidney function. The second is renovascular hypertension, means there may be narrowing of the arteries which are supplying the blood to the kidneys. So the age of onset sometime may give you the idea, may give us the sense, sixth sense, that may give us the idea that we need to start working on the patient, and he may be having some underlying kidney disease and which we are missing. Then the requirement of antihypertensive. This is very important, that if the patient says initially I was requiring just one BP, one blood pressure tablet, one BP tablet, and off late I have started noticing that my doctor is writing me two BP tablets, three BP tablets, so that my blood pressure is not coming under control despite one or two BP tablets. So that may be the start of kidney disease, and that's why you are getting the resistant hypertension. What is resistant hypertension? The resistant hypertension is whenever you are requiring the three blood pressure medicines, especially including one medicine which makes you to have more urine, like diuretics. So these are the people are again prone that they may get kidney disease, or they may be having a kidney disease. Then antihypertensive medication complications. We need to understand sometimes the medications, there are antihypertensive medications which are very good to control the protein in the urine, or which are very good medicines to start the antihypertensive therapy. But these medications sometimes need monitoring whenever you are adding them, because it should not further complicate the kidney disease. So these are the some simple points which we need to take in the consideration whenever someone is saying they are having a blood pressure. So at here the very important two important points which you can keep in the mind: the age of onset of blood pressure, whether there is a more and more requirement of antihypertensive medications. Yes, these things may point you towards this resistant hypertension may point you towards some underlying kidney involvement. Next slide. Urine test. Why this urine test? The urine test is very important and very cheap test, very non-costly test, because then urine the three very important point which we see is the presence of protein in the urine. The presence of protein in the urine may give us the idea that there is some problem at the filter membrane, because in the non-medical language, what I can in simple words I can explain you, that why there is a protein in the urine. Whenever there is a swelling or whenever there is a problem with the kidney filter, there will be the protein in the urine. The second important point will be the hematuria, or the blood in the urine. The blood in the urine means whether if you are having the gross red colored urine, or whether there are red blood cells in the urine despite you are having a normal urine color. In both ways, the patient is going to require a workup for kidney disease, presence of stones, presence of cyst, or any nephropathy, which will need a further workup. And the last point will be the pyuria, means the presence of pus or WBC white blood cells or pus in the urine. Next slide. Now coming to the sonography. Now many times this happens that people do the annual checkup, or in a pre-employment checkup they do the sonography, and in sonography they see the report is normal, and then they feel that yes, everything may be normal. But there are silent features which you may start suspecting whether we may need a workup for a kidney disease. The first is renal sizes, whether your kidney size on the sonography which is mentioned are normal, are enlarged, or they are small for the day, small for your age. So if the kidney sizes are small or large, you may start suspecting that there may be problem and you need a workup. The unequal sizes, for example, one kidney is 9 centimeter, other kidney is 7 centimeter, or one kidney is 10 centimeter, other is 13 centimeter. So if there is a unequal kidney sizes, yes, we may start suspecting that this is a time where we may need to work up. Renal Doppler. The renal Doppler is a test which is done during the sonography only, to know whether the kidneys are getting adequate blood supply or not. And of course, on the sonography, we can know whether there are any polycystic kidneys or a presence of cyst or stone in the kidneys. And accordingly, we can further start treating the patient. Next slide. So this is in the short about what are the important points excuse me, what are the important points where we may suspect that this person needs a workup related to the kidney disease, or we may need to start thinking on the points of a kidney disease. And all this is not to increase the kidney disease burden, but this is to diagnose early so that we can reduce the complication, we can reduce the advanced stage of the kidney disease. This is not that you want to diagnose the more and more kidney patient, but you want to not let them get detected at advanced stage. From here, I will request Dr. Bahadur sir to take over the discussion about this topic.
Okay, good evening, friends. So, if there are any questions to start with, you are most welcome to ask me that. And if you think that you need to take time for that, I will tell you a few points which are still more basic to what Dr. Chandan has beautifully pointed out, how to diagnose early kidney disease. That's very important. Now, even before that, as most of you are all normal people, so the question is how to protect my kidney even before I get diseased. So, number one, healthy lifestyle. What about water? That's the common question. Well, if you are less than 60, you should have enough water to hydrate yourself. If you are more than 60, then be very careful in increasing water intake. People take a lot of water because they feel that it will flush my kidneys. Well, if your kidneys are normal, then it's a good idea. If you have a kidney stone disease, then it's a good idea. But if your kidneys are already affected to a certain extent because of maybe hypertension, diabetes, and more commonly old age, anything more than 60, don't drink a full can of water before in the morning, first thing in the morning, because you can land into hyponatremia. So a good thing can be, it is taken in a good measure. So water, yes, keep yourself hydrated as far as the kidney is concerned. But if you are more than 60, go by your thirst. Do not try to overdo the water. That is important. Number two, what about food? Well, the job of the kidney is to remove the nitrogenous waste, which is produced as an end organ, end product from the protein. So a very high protein, meaning a protein-rich diet, especially with a lot of non-vegetarian food. While you are young, normal is a good idea. But maybe you should not really stretch it too far. So a very high protein diet for the kidney is not a good idea. And also it leads to some stone formation. So please increase the number of vegetables in your diet, vegetables and fruits. They would lead to more healthier kidney. Because at the end of the day, the kidney has to clear the nitrogenous waste. It is becoming a fad among the youngsters to take, when they go to gym, that they take high proteins. So 6 eggs along with some protein supplements, and they can land up into a serious kidney problem. That's not a good idea. So everything, moderation, food, protein in moderation, and then we come to the salt. Well, here, salt, which is less, is a good idea, because it has been shown that it's not only good for your blood pressure, but it is also good for your kidney. So, water, food, salt, about fats, again, in moderation. And then we come to exercise. Well, people feel exercise is only for the heart. Not necessarily. It's also good for the kidney. Weight. So if you are overweight, that's not a good idea at all, because it can actually lead to a kidney disease, which is known as FSGS. So being obese or being overweight, the balance between the glomerulus, the filtering capacity, and the excreting capacity actually goes haywire. So it's not a good idea to be overweight or obese. And then we come to the two commonest problems that happen with normal people. For simple headaches, people taking NSAIDs like Voveron, Combiflam, over-the-counter medications. Not a good idea. So maybe a paracetamol or Tylenol is safe, but any NSAID taken for a longer time in a dehydrated stage is very bad for the kidneys. So no over-the-counter painkillers for you. Second, alternative medicines and traditional medicines. In India, we have got Ayurvedic medicines. So herbal medicines and medicines with heavy metal is not a good idea for the kidney. So if you want to keep your kidney healthy, please avoid this. And then people thought that smoking only kills cancer of the lung. You are mistaken. Smoking is bad for the kidney also. And so are any recreational drugs and other medications. And so if we have during this time taken care of all these things, and then what Dr. Chandan has really out, who are the people who need to screen for kidney diseases? Maybe not everybody, but one has to understand 1 out of 3 people are in the world, and 1 out of 9% is having some sort of kidney disease. So groups are the diabetics, the hypertensives, the ones with family history of any like DPKD, and those who are stone formers. So if one has diabetes or blood pressure or a stone disease, please use all the measures that have been outlined by Dr. Chandan Chaudhari. If you can prevent, that is the best way of going forward. And you may prevent at the chronic kidney disease stage 1, 2, 3. When you go to the stage 4 and 5, we can only retard progress, but we cannot prevent progression. So diagnosis was discussed are extremely important. I have what you can do if you are what Chandan has told you. If you so control your blood pressure and diabetes to the best. See that you do not get obese, get any tobacco or recreational drugs, stop any NSA, what you eat and how much protein is getting in, and exercise caution when pain conditions. And do that, not only we will prevent disease, but by early screening, we can see that any disease is cured or prevented from further progression. And so if there are any other questions on this, you are most welcome to ask me or Dr. Chandan. It could also be any personal kidney issues that one would like to discuss. I would be open to it. Any personal kidney issues, anybody's on the audience is okay with me.
Dear participants, I would like to request you, if you have any questions, you can ask from our
And
doctor,
if
Dr. M Bahadur sir and
then
Dr.
I think,
Chandan Chaudhari sir.
yeah, so basically, please take care. Kidneys are very important and they are the 9th leading cause of death the world over. Remember those 3 figures. Every 3rd person is at risk of kidney disease in this world. Every 9th person in this world already has a kidney disease but does not know about it. And the 9th commonest cause of death, mortality, is kidney. So, dear friends, I think it has been a good session. Dr. Chandan has really given you good food for thought. In case anybody is diabetic, hypertensive, or a bad kidney disease, how to go about it. Thank you.
Sir, I request you all, wish you a great day ahead. We'll stay connected.